Hello, my name is Dr. Diwan S. Raja. Today I will discuss about Mycosis fungoides. Mycosis fungoides is the most common type of cutaneous T-cell lymphoma, CTCL, a rare chronic slow progressing skin cancer that primarily involve malignant CD4 plus helper T cells. This disease has multiple stages. One of the initial stage is the plaque stage here. So we are seeing the plaques here. Okay, this is from the Google image research gate. So a lot of plaque in the body. After the plaque stage, we'll get the nodular stage, we'll get the fungiform stage, we'll get them all. What is the pathophysiology? Malignant T helper cell CD4 plus home to the skin. Cells exhibit epidermotropism, migration into the epidermis without spongiosis. May form portrait microabscesses, clusters of atypical lymphocytes in the epidermis. Immunophenotype, typically CD3 plus, CD4 plus, CD7 minus, and CD8 minus. Clonality of TCR genes may be demonstrated via PCR. So we got the pathophysiology and immunophenotype. This is a malignant T helper cell home to the skin. This condition. Cell exhibits epidermotropism, migration to the epidermis without spongiosis, may form portrait microabscesses, clusters of atypical lymphocyte in the epidermis. Clinical stages, patch stage, early, most early, flat, scaly erythematous patch resembling eczema or psoriasis, often in sun-protected areas, that is in buttock and flanks. Plaque stage, thicker raised lesions may show poikiloderma, hyperpigmentation, atrophy, telangiectasia. Tumor stage, nodular tumor that may ulcerate, may show systemic dissemination, lymph node, liver, spleen, lung. Sézary syndrome, leukemic variant, triad. Triad include erythroderma, lymphadenopathy, and malignant T cell, Sézary cell in the blood. Sézary cells are atypical lymphocyte with cerebroformic nucleus, hyperchromatic, a lot of depression elevation like brain. So it is called atypical lymphocyte, also called Sézary cell. So we have three stages. Extreme early stage is patch stage, then plaque stage, then the tumor stage. And the malignant variety to the blood, like blood cancer type, there is the Sézary syndrome, where you will get the atypical lymphocyte in the blood or the Sézary cell in the blood. So this is the manifestation of the disease in a brown-skinned Indian man that is from Indian subcontinent. We are looking at the patches, then we'll get plaque, hard area. Okay. Then here we'll get the tumor almost like a mushroom-like tumor. It is called Mycosis fungoides but it is not caused by fungus, but it looks like a mushroom apparent resembling tumor. Okay, and this was first described by a French physician nearly 200 years back, this type of mushroom type skin cancer. Diagnosis: multiple skin biopsies from representative lesions, histopathology, atypical lymphocyte with cerebriform nuclei, portrait microabscesses in the early stage, T cell gene rearrangement testing confirms clonality, staging with CT, PAT, or lymph node biopsy. Okay, we got the diagnosis. We need multiple skin biopsy. We will get atypical lymphocyte with cerebriform nuclei, portrait microabscess, T cell receptor gene rearrangement testing confirms coronality, staging with CT, PAT, or lymph node biopsy. Treatment of mycosis fungoides: treatment varies by stage, skin directed therapy, early stage, topical steroid, phototherapy, topical nitrogen mustard, local radiation, systemic therapies, advanced stages, interferon alpha, bexarotene, retinoid, histone deacetylase inhibitor, borinostat, chemotherapy, that is CHOP regimen, allogenic stem transplant in selected cases. So we have local treatment and systemic treatment. And we use local steroids, here interferon alpha and other medications. Prognosis: indolent course in early stages, prognosis, progression to former tumor stage, and systemic involvement. If it goes through that, there is poorer prognosis. Sézary syndrome has median survival rate of 2 to 4 years, but mycosis fungoides may present in a person for 70 years. Some records was diagnosed with mycosis fungoides at the age of 9. That lady died at the age of 79 due to causes other than mycosis fungoides. Now we'll go through the differences between mycosis fungoides and Sézary syndrome. Actually, Sézary syndrome is a type of mycosis fungoides, the last stage, when you will get the Sézary cell or a typical lymphocyte in the blood. Let's start. Definition: most common CTCL, localized skin involvement. Sézary syndrome, leukemic variant of CTCL with systemic involvement. Onset: indolent, develops slowly over years, maybe 70 years. Here, Sézary syndrome, acute or subacute presentation. Clinical feature: patches, plaques, tumor. In Sézary syndrome, generalized erythroderma, more than 80%, body surface area, pruritus, blood involvement, rare in early stage, Sézary cell, malignant T cell in peripheral blood. This is the diagnostic. A typical lymphocyte with cerebriform nuclei with peripheral chromatins. Lymphadenopathy, late stage finding. Sézary syndrome, present early. Skin appearance, localized lesion and poikilotherma, different pigmentation plus telangiectasia, that is poikilotherma, derma. So, Sézary syndrome, diffuse red, scaly, exfoliative dermatitis like characteristic cell here, cerebroform skin biopsy, but this type of cell, Sézary cell present in blood smear, maybe in the peripheral blood smear in many cases. Diagnostic tool skin biopsy, TCR clonality. Here Sézary cell, diagnostic tool blood smear, flow cytometry, TCR studies, immunophenotype CD3, CD4, CD7 minus, CD8 minus. Here in Sézary cell, Sézary syndrome, same as that of the Mycosis fungoides, higher clone burden in blood. Course, indolent and chronic. In Sézary syndrome, it is aggressive. Okay, it is aggressive. Prognosis in Mycosis fungoides favorable in early stages, 10 plus years. Caesar cell in blood smear, poor, median survival 2 to 4 years. And that's all about the Mycosis fungoides and its difference with that of the Sézary syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.